This is the FM Gold channel of All India Radio. In the program News Analysis, now we bring you a discussion on pharmaceutical purchase policy for 5 years. The participants are Jayashree Gupta, former Additional Secretary, Ministry of Consumer Affairs, and Aditi Tandon, the Tribune.
The Union Cabinet yesterday approved a policy for procuring medicines produced by the central pharma public sector undertakings. And this move is actually meant to ensure optimum utilization of the central PSUs, which have not been in good health for a long time now. And also the theme is to ensure availability of medicines at lower prices. Because if the government is procuring from central PSUs, naturally the profit margins will be lower and the orders will be bulk, and naturally the prices of medicines will be also lower, and this benefit will ultimately pass on to the consumers. Now this purchase policy was being awaited for a long time because earlier purchase policy lapsed in 2011, and now yesterday the Union Cabinet has made another commitment to the country that it's going to buy all the medicines that are being produced by the 5 central pharma companies. How do you look at the development?
As a matter of fact, earlier policy which was made in 2006 elapsed in 2011. It should not have been allowed to elapse. It should have been continued because it allowed pharma PSUs to continue their production. It allowed them to improve their performance, and it also ensured availability of medicines which are required for masses. Because we have seen many a times that private drug companies, they are in the business of making money. They are not very much concerned about the public health issues with which government should be concerned, with which all the citizens of this country are concerned. So tablets which yield low margin, they generally tend to go out of market, but they are essential for public health programs of the country, of the government.
Right, and the uniform policy will also apply to the state governments, and they will be required to also procure from the central PSUs insofar as the programs like NRHM are concerned at the state level, and various other tuberculosis programs and all that. So to that extent, 103 medicines which will be covered by this policy will be then nominally priced for the consumer. And it is also suggested that there will be a 16% further discount on these medicines, though the taxes will have to be passed on to the buyers. Do you foresee a considerable drop in the prices of, say, these 103 medicines?
See, these medicines will go into the government health programs. They are not being procured for being dispensed through chemist outlets. So, as a consumer, I don't think it will make much difference. This will ensure availability, but I have a feeling, I think we'll come to that issue later, that these prices which are fixed for these medicines, that should be the price at which consumers should be able to buy medicines from chemist shops, from retail outlets all over the country. Then actually this would make a real impact.
As you said that a lot of private companies do not venture into markets where profit margins are low. For instance, we keep having issues with medicines related to Kala Azar. There are no availabilities and the health of the people suffers. So I think looking at this shortage of important essential medicines where profits are low, this purchase policy can make a marked difference because not only will it ensure manufacture, it can also help in directing production towards a certain sector, isn't it?
Yeah, sure. Tablets, like when I was in IDPL, I saw that IDPL produces iron tablets. Just sell for a few paisa. It's very low priced product, and generally big companies are very reluctant to produce it. But we have seen there's huge iron deficiency, particularly amongst women and children, and they are required for the country.
So to that extent, the policy can really be used to benefit consumers, though indirectly in this way. One more thing that we need to discuss here is that, as you said, there is no direct benefit for consumer unless the retailer is selling the medicine at a low cost. The debate really here is that the pharma PSUs in India have been sick for a very long time. IDPL was declared sick in 1992, and recently the government had launched a scheme for the revival of Hindustan Antibiotics Limited. They had also waived loans to the extent of 200 crore, and they had also pushed in money to the extent of about 160 or 170 crore. Do you think the purchase policy alone, in terms of procurement of medicines which they are producing, is enough to revive these?
As a matter of fact, government is owner of these public sector undertakings. undertakings, and they should act like owner. They should take quick decisions. If they want to run it properly. If they want to close it properly. IDPL, I know it had huge manpower, 13,000 people, and those 13,000 people spread over so many locations. If those plants which have been set up for a particular purpose, they are not working to their optimum capacity. It's very important to make it cost effective, to go into business which is actually required, which is the need of the day. So had this restructuring been done every 5 years, every 10 years, then IDPL would not have become sick.
Do you think a lot of this has to do with the fact that you're talking of the 60s, and naturally IDPL performed a big role in self-sufficiency in respect of medicines in India, but it was getting preferential treatment at that time, and then the liberalization came in. Yes. And after the liberalization era, you had all kinds of players enter the market. But also we can't discount the fact here that the central PSUs which are producing pharma cannot perhaps indulge in a lot of practices, which private players can indulge in. For instance, nexus with chemists, retailers. Can you reflect on that?
Yeah, sure. Actually, that is the bane of pharma industry or entire medical sector, that it is governed by these nexus. Doctors prescribe medicines where they get some direct or indirect benefit out of it. And pharma companies are all out to woo doctors, medical professionals who can prescribe medicines which they want. It's true that PSUs by definition cannot do it. But even in the ethical market, if that restructuring was done, we are not looking at pharma sectors selling medicines worth 10,000 crore, 20,000 crore. For a company like IDPL, even with 1,000 crore sale, it would make a very huge impact on the healthcare sector of the country as a whole. So maybe they'll not go up to 10,000, they will be contented at 500 crore, 1,000 crore. There is a market which they can capture even with ethical practices. But this restructuring, this infusing of money if it is required for upgradation of plants, this change of track from time to time, if today we require medicines for a particular disease, they should be able to produce those kind of medicines. If plants in IDPL I was posted there in 2006, and Schedule M, government had introduced this Schedule M requirement, and most of the units in IDPL were not Schedule M compliant. So after all, you require money. In 92, IDPL was referred to BIFR. I walked in 2006, and I found it like a ghost house. It was really a ghost house. So government as a owner should have decided whether they want to run it. If you want to run it properly. If you want to close it properly. Why have you kept those 350 people for so many years in coma? That is something very wrong.
These are very valid points, and also the whole issue of professionalism in pharma companies. How do you have good manufacturing practices unless there is absolute professionalism, unless you have the right kind of people heading these institutions, and also you're infusing cash at regular intervals, perhaps not in fits and starts, just like we are now perhaps doing.
There has to be a certainty that this is the track it is going to follow, that government as owner of those PSUs has to have this business sense that this is what is the requirement of the market today, this is what they should be doing, and this is how they need to do it. So whatever restructuring is required, maybe with very small infusion from time to time, they could have done a wonderful job. But since those decisions are not taken, people stagnate and companies stagnate, and then they come to this stage.
Because also this debate becomes very relevant in respect of India's aspiration to achieve universal health coverage. We have been now debating this issue for a while. The Planning Commission, as you know, had in the run-up to the 12th plan document set up a high-level expert group which was headed by Dr. K. Srinath Reddy, the President of Public Health Foundation of India. Yes. And they had very categorically maintained that let us raise also our health expenditure, public health expenditure, to a certain level of GDP. We've had these promises in election manifestos for long, but budget has always been an issue. What do you have to say on that? Because unless overall our attitude towards the health sector changes, we cannot really achieve these goals.
You are very right, Aditi. Our attitude has to change. We have to give priority to health sector in terms of budgeting, allocating percentage of the total budget to it. But more important than that is the fact that at policy level, even without increasing any budget, much can be done just by adopting the right policies. I'll give you some examples. Even today, in spite of the fact that we have huge network of government hospitals from state to district to primary health center to sub-center, which is village level. Even now, 80% of our people go to private sector for treatment. And more than 70% of their treatment is the cost of medicine. So medicines constitute a very huge part of their healthcare expenditure. And this medicine, so what medicines are prescribed by the doctor and at what rate those medicines are purchased by patients, that really affects the health of the people of this country. I'll give you two examples. One is this cetirizine tablet. Jan Aushadhi outlet government has opened. Government fixes price at cost plus nominal profit basis. So cetirizine tablet, which is taken very often for cough and cold, Jan Aushadhi price is ₹2.75 for a strip of 10 tablets. The top selling brand of the same medicine with same component but with a different name sells for ₹37.50. Storvas, which is used for high cholesterol, Jan Aushadhi price is ₹8.20. And atorvastatin in the name of generic name. And brand name is Storvas, which is a top selling brand, sells for ₹96. So if you are a chronic patient of diabetes or hypertension or heart problem or thyroid or any of the problem where you have to take medicine over a long period of time, then you can imagine the impact on the consumer. So this results in many people not getting treated. They just stop buying medicine, stop taking medicine, or being inadequately treated.
So do you think the recent drug pricing policy wherein they included 348 drugs as against 74 earlier under the essential medicine list, national essential medicines list, it's going to help? Because they've changed the price fixation formula and weighted average is now the...
So I'll tell you, we raised a lot of hue and cry on this issue because common man is not able to understand the implications of this policy. Government said that instead of 74, we'll have 348 medicines. But they said that prices of top three brands, average of top three brands would be the market price. We raised hue and cry, then ultimately government has accepted that average of top all brands having market share of 1% or more would be worked out. So that will provide some relief to consumers. The price will not come down to ₹2.75 for cetirizine instead of 37 rupees, but definitely some relief.
Right. Then
if it is implemented properly.
Let's hope the prices of medicines reduce further. Thank you so much.
Thank you.
You were listening to a discussion on pharmaceutical purchase policy for 5 years. The participants were Jayashree Gupta, former Additional Secretary, Ministry of Consumer Affairs, and Aditi Tandon, the Tribune. It came to you in the program News Analysis, produced and presented by the News Services Division of All India Radio. This program is also available on our website, newsonair.nic.in. You may email your opinion about this program at airnsdtalks@gmail.com.